Welcome, everyone. Hi, I'm Kevin Riley, the editor of the Atlanta Journal-Constitution. We're bringing you the second virtual event in our spring Aging in Atlanta series today. Our panelists will be speaking on a variety of topics: estate planning, health and wellness, senior resources, and travel. Everyone will make their own introduction, and then I'll have a conversation with each panelist for a few minutes. But before we begin, I want to thank our sponsors who are making this broadcast possible today: Kroger and Wellstar Health Systems. So to start, here are a few words from our presenting sponsor, Kroger.
Kroger is a proud presenting sponsor of the Aging in Atlanta series. Shopping for your groceries and essential household items is even easier with pickup. Whether you're home or finally hitting the road for a getaway this spring, just shop online, choose a pickup time convenient for you, and the Kroger team will carefully pick out your order and bring it to your vehicle when you arrive. So the next time you're ready to shop at Kroger, take advantage of free pickup. It's just another way Kroger is fresh for everyone.
Okay, so here's what we're going to do. We're going to let each of our panelists introduce themselves. So let's do that. And first, we'll start with you, Shannon.
Thank you, Kevin. My name is Shannon Pauley. I'm the managing attorney at the Estate and Asset Protection Law Firm in Decatur, Georgia. I am a dual state licensed attorney with the Masters of Law in Tax. I've been practicing for over 23 years. My passion is to assist people to age with dignity, grace, and independence. This passion is shared with my team, and it's one that we thrive in every interaction to ensure for our clients. And we're happy to be here.
Thank you, Shannon. Dr. Humphreys.
Greetings. My name is William Humphreys, and it's a pleasure to be here. I am a board-certified vascular neurosurgeon, part of the Wellstar Neurosurgery Group here in Marietta, Georgia. I am a Georgia native. A little bit about myself: I'm a Georgia native and was born in Milledgeville, Georgia. I moved to the Atlanta area when I was about 13 and attended Columbia High School in Decatur, Georgia. Go Eagles! After which I did my undergrad training at Morehouse College and majored in biology. Went on to go to medical school at Duke, after which I did my neurosurgery training at the Texas Medical Center at Baylor College of Medicine in Houston, Texas. After that, I did a combined 2-year neurovascular fellowship in Memphis at the Sims Murphy Brain and Spine Institute. It's a pleasure to be here, and I look very much forward to talking about stroke care and a lot of the exciting things that we're doing here at the Wellstar Medical Center.
Thank you, Dr. Humphreys. Michelle.
Hi there, my name is Michelle Blaylock. I am a pharmacist with Kroger Health. I have 20 years of clinical and operational pharmacy experience. I received my degrees from Mercer University, and I have a strong passion for people. I specialize in medication management, immunizations, and point-of-care testing within the community.
Thank you, Michelle. Dr. Hart, you.
Hello, my name is Dr. Justin Hart. I'm also with the Wellstar Medical Group. I'm a radiation oncologist. We'll talk a little bit more about what that is, but I am a medical director for the radiation oncology program at Wellstar's Cobb Cancer Center, and I'm grateful to be joining the conversation today.
Thanks, Dr. Hart. Brendan.
Thanks for having me on the panel today, Kevin. It's great to be back with the Aging in Atlanta family. My name is Brendan Underwood, and I'm the outreach coordinator for Georgia Relay. We provide a service for individuals who have difficulty hearing or speaking to connect over the phone. As an outreach coordinator for the past 5 years, I look to educate agencies, civic organizations, businesses, veterans, and folks like you all about our services. The cool part about my job is that I get to share these life-changing services that we provide throughout the state. I'll even share with you a little bit about how this service provided connection for my own family.
Thanks, Brendan. And finally, Robin.
Hi, I'm Robin Washington. I'm a strategic account manager for Royal Caribbean International. I'm based here in Georgia, and I have the pleasure of partnering with professional travel advisors to create an incredible experience for travelers, as well as really planning innovative conferences and corporate incentive trips. Prior to joining Royal Caribbean, I actually spent the vast amount of my career in media advertising sales, including as the travel advertising manager at the Atlanta Journal-Constitution for well over a decade. My real passion for working in the travel industry is fueled by the impact on travelers. from their initial inspiration to the excitement of the anticipation, the many connections and discoveries during the experience, as well as the memories they can always reflect upon. And thanks for having me.
Well, it's great to have all of you, and thanks for joining us today. Shannon, I'm going to come to you. We're going to start our conversation with you. And so first question, so many of us, we have our estate documents done. We've been through that process. We're feeling good, like we're prepared for whatever might come our way. So should we think about updating them? And if so, how often do I really have to do that?
Kevin, that is such an important question, because too often, as I interact with individuals, they are under a mistaken belief that when it comes to estate planning, you're one and done. But what I emphasize is that your estate planning is a journey, and it is not a final destination where you only have one stop along the way. Because as we age, as we bring new people into our life, new family members exit, our assets increase, our assets decrease, etc., where we were 5 years ago is not where we are today. So for that reason, what I emphasize is that your estate plan should be reviewed every 3 to 5 years. That doesn't mean redrafted, but you've got to make sure that your estate plan is growing with you, and it is not an anchor that is several years in the past, that is not living currently to your assets.
Thanks, Shannon. Now, this is, we get these questions from the folks who attend these sessions, and they're often specific and they're always important to them. So here's one. How much control can I have on my beneficiaries' access to my assets through estate planning documents?
So there's different methodologies where both during your life and after your passing, you are able to maintain a control over access to your assets after your passing. As an example, let's say that you have 2 children. You have economically responsible Robin, and then you have Gary the gambler. Well, here's the comment. You do not want both of them to receive the inheritance outright. Why? Well, Robin's going to do great. She's efficient. She knows how to manage affairs. So all of these assets, all of these resources you've accumulated during your lifetime, when Robin receives them, she's going to continue to go forward to make them as a tool, as a resource to continue to thrive herself and her family. But Gary the gambler, what do you think Gary the gambler is going to do as soon as he receives those funds? He is going to go down to the track and he's going to bet it all on the ponies. And guess what? House always wins. So some control that you can do are things that are called trust. And for example, through your will, you can have what's called a testamentary trust. And in that trust, you can control Gary the gambler's access to the funds, either through him receiving a steady amount over a regular period of time, where he cannot have access unless the trustee deems it to be appropriate, or you could have it to where he doesn't get anything until an age certain. This is an example of why it's highly important that when you are doing your estate planning, know your beneficiaries and know and protect your beneficiaries, both from others, but also from themselves.
So that raises another interesting question that we got, which is, can people challenge my wishes in a will?
They can. And let me explain. As I stated, your estate plan should be reviewed every 3 to 5 years. Sometimes that will include redrafting. So let's say that you come to me and you had a will drafted 5 years ago, and now life circumstances and economic circumstances have changed to where originally you wanted everything to go equally between your 2 kids, but now one of your children is not in a situation where it's feasible for them to receive the same amount. Now, when you create a new will, please make sure you destroy the old one. Don't keep it for some type of sentimental value, because what will end up happening is a challenge, just like what we're talking about here. You'll have a dueling of the wills. And just because there's a will that's a later date does not necessarily trump the other will in a challenge. Because what a person could say is, well, yeah, that will was drafted last year and mine's 5 years old, but oh, mom didn't have capacity at that time. So that one doesn't matter. We got to go with this will here. Or the vice versa, sitting down and stating that this was revoked in this new will. Unfortunately, when it does come to wills, there can be challenging of individuals and beneficiaries as to what is detailed therein. Now, there's ways to get around this. And that is through the creation of inter vivos trust, where at that point, the trust, because it's not public record, only people that can know you have a trust are those that are either actively participating in its funding, in its management, or in receipt. And so therefore, a forum for challenge is very limited in that facet.
Now, Shannon, switching to another topic that I think is always on a lot of people's minds. What are some long-term care strategies to help limit the financial expenses, as we need increasing levels of care upon aging?
So before I start to answer this question, I would like to bring up a misconception that a lot of people have when they're working with their attorneys. And the misconception is that an elder law attorney and an estate planning attorney, they're the same, they're synonymous, but they're not. What I emphasize to you is that your elder law attorney is focusing on what if you live? How can you make sure that your assets that you have spent a lifetime accumulating are going to maintain your quality of care and quality of life while promoting your legacy with whatever remains? Estate planning over here is only focusing on what happens when you die. What's your legacy? Who are you protecting? So under this elder law focus, this is where you're going to start doing asset protection trust. You're going to be doing strategy so that you can do a proactive 5-year strategy for Medicaid eligibility while protecting assets. You're going to be able to ensure that you can qualify for governmental benefits, not only Medicaid, but if you or your spouse is a wartime veteran, there's opportunities for VA pension, aid and attendance. So long-term care, which is expensive, there are avenues of not only protecting your assets, but also qualification for governmental programs or the utilization of your assets for long-term care insurance.
Shannon, here's a question that comes directly from one of our readers. Mom recently died. When Dad died in 2016, we didn't have to go through probate. Why are we being told we have to go through probate now for Mom?
This is very familiar. So what I emphasize is very often in a marital union, assets are owned jointly. And as they're owned jointly, when the first spouse passes by operation of law, a joint bank account, a home that's owned with right of survivorship, it naturally transitions to the surviving spouse. So that is why when Dad passed away in 2016, there was no need for probate because there was nothing in Dad's individual name at time of death because everything was jointly owned, just naturally transitioned over to Mom. Well, now when Mom passes, these assets are no longer jointly owned with another individual. As such, when she passed, these were in her individual name. As they were in her individual name, in order for them to go to the ultimate beneficiary and for title to transfer, the only way to have that occur is through the court, specifically through the probate court.
Well, thank you so much, Shannon. Really appreciate those insights. Now, before we go on to our next panelist, we have a message from our gold sponsor, Wellstar Health System.
You are not a cancer case or a clinical trial patient or a chemo appointment. You're you, and you deserve a team of experts who treat you that way. A place close to home where the best care in the world revolves around your needs. Because after all, there's no one else quite like you. Wellstar, more than healthcare, people care.
Now let's welcome Dr. William Humphreys to answer some questions about strokes. What can people do to prevent strokes?
So this is a very good question. It's one I get asked a lot by my family members and patients as well. And when I talk about risk factors for stroke, I always tell people that there are things about our life that we can control, and then there are things that we can't. And so that falls on the two categories, which are modifiable risk factors and non-modifiable risk factors. So things that you can't control in your life are, for instance, your race, your gender, the genetics, your DNA that you were born with. But then there are a lot of things about strokes that also, or risk factors that contribute to stroke that we can control. That's our diet. That's whether or not we live a sedentary lifestyle. That's whether or not we are working with our primary care physician to control some of the disease processes that predispose us to developing strokes. And then that's our habits. So things like smoking, chewing tobacco, using things like cocaine and amphetamine. So I'll go through a little bit of all of those and let you know. As it pertains to disease processes, so a lot of the things that predispose us for developing a heart attack also predispose us for developing stroke. So diabetes, high blood pressure, hypercholesterol, obesity, and living a sedentary lifestyle. And so really important to have a really good relationship with your primary care physician as well as a pharmacist to make sure that you are on the right medications, that you're taking those medications as they should be taken, and that you're working to make sure that you're keeping all of those parameters where they need to be in terms of your blood pressure, your hemoglobin A1C, your blood sugar, and your LDL. Next is addressing this issue that I hear a lot of people say when they say, well, strokes run in my family. Well, it may be the case. Usually it's the case that less than 1% of people have what we call these inherited diseases that predispose you for developing strokes. Usually it's the case that what you have inherited is a lifestyle. So I'm from Georgia, I'm from the country, we live in the stroke belt, and I can tell you for a fact that the way we eat, the way we cook our food, the way we approach sometimes taking medications and those types of things are lifestyle things that we may pick up from other people. So it may be the case that your mom, your aunt, and your uncle, and your grandfather all died from strokes because they all ate the same food and lived the same lifestyle. So sometimes you have to try to break that cycle. And then lastly, as it pertains to cigarettes and kind of other illicit drugs, tobacco is bad for you. Smoking, vaping, chewing, or consuming in any way, as is nicotine. So I know it's very difficult to quit, but that's one thing that if you can control it, puts you much further ahead of the game. And then, also some of the other things that are toxic for our blood vessels are things like cocaine and amphetamine. And so those modifiable risk factors are things that we can try to control to prevent our risk for developing both ischemic as well as hemorrhagic stroke.
What are the symptoms of a stroke that we should all be aware of?
That is a very good question, and my patients ask me that a lot, as do my family. And I think before we can get into that, it's important to understand how we define a stroke. A stroke is basically the acute onset of a focal neurological deficit, and that deficit can be due to either the brain not getting enough blood, oxygen, because there's an obstruction and blood is not getting to the brain, or in some instances, it can be due to a blood vessel rupturing, in which case you have blood that goes out into the brain and causes damage. Under the rubric of strokes, the majority of them, I'd say 80% of them, are of the ischemic type. But there are also types, particularly of patients who are hypertensive or patients who have aneurysms and other things that have hemorrhagic stroke. So I'll start with the first one. The signs and symptoms are usually of an ischemic stroke where the brain's not getting enough blood. That's usually acute onset of what we call some type of weakness on one side of the body versus the other. Sometimes you can have visual changes, particularly a shade coming down over your eyes. One thing you may experience, changes in your speech. Other changes that may be atypical would be things like vertigo, dizziness, feeling like the room is spinning, or you may pass out, or you may have difficulty in terms of the way you chew and swallow, or the way that your mouth moves. If it's a hemorrhagic stroke, that presentation may be a little bit different. It may be the case that all of a sudden, boom, you get a very big headache, worst headache you've ever had in your life. It may be the case that your neck starts to get stiff. The light hurts your eyes. You may pass out. So depending on the type of stroke that you have, that will determine how you present. But I think the important thing is to realize whenever you start to feel or you see a family member that has a deficit, neurological deficit that they did not have before, you should immediately start thinking about the possibility that this could be the beginning of a stroke.
When someone comes in for treatment of a stroke, or you bring a family member in for such treatment, what should people expect? What will happen? What will the doctors do?
I think it's very important to realize that the way that we take care of what we call neurovascular problems, these are strokes, these are aneurysms, this is bleeding into the brain, this is trauma related to blood vessels, has very much evolved over the last 10 to 15 years. Not only do we have different medications, we have different ways of treating these patients, both with open surgery, but also in minimally invasive ways by going through the groin and treating them with stents and catheters. And it's important to realize that the way we do that is very much a systems-based, integrated, multidisciplinary approach that requires an integrated healthcare system. So in order to move a patient through the system effectively, you need to have neurointensivists, you need to have fellowship-trained neuroradiologists, you need to have neurovascular surgeons, you need to have vascular neurologists, And you need to have this whole armament of critical care nurses that can take care of these patients. So that's number one. And number two, you need to have the technology that you need to do these complex procedures. That's microscopes. That's, biplane systems, rooms, entire rooms that are devoted to taking care of patients who have these neurovascular symptoms. And you need to be able to do that in real time, which means you need to have a process in place that allows you to move patients in real time to save time, to increase the probability of them getting better. And so with that, we have neuroimaging that's based on artificial intelligence that allows us to see on our telephone when a patient comes on, or even on my iPhone, my iWatch, when a patient comes into the emergency room, and we immediately begin to talk about how we're going to move that patient through the system, if they need to be treated, what type of treatment they need, and what the plan will be. And so that integrated multidisciplinary approach to providing what we call comprehensive neurovascular care, not everywhere can do that, but I think Wellstar is one of the places in Georgia that does it the best.
Can you talk about a stroke versus an aneurysm and how they differ? One of our readers also wants to know if you can explain what a mini stroke is.
So this is the question I also get a lot from my patients, and sometimes also from other colleagues. So we talked about what a stroke is. It's an acute onset of a neurological deficit that can either be related to the brain not getting enough blood or due to bleeding from a ruptured blood vessel. Where an aneurysm comes in is that an aneurysm is not a stroke per se. An aneurysm is a weakening in the wall of the blood vessel that predisposes you for potentially developing a hemorrhagic stroke. And here's how that works. So the way I describe it is, if you've ever worked in the yard, I'm from the country, so we use water hoses to water grass or water a garden. Sometimes you'll see that old water hose that has a bubble that comes out the side of the water hose because it's weak or it's old or it's deformed. Well, that's basically, in a certain sense, what an aneurysm is. It's a weakening in the wall of the blood vessel. Over time, if that weakened wall begins to weaken even more, the pressure that comes from the fluid going through the vessel can cause that aneurysm to rupture. If that aneurysm ruptures and you have blood that goes out into the brain, you now have what's called a hemorrhagic stroke. So the aneurysm itself is not the stroke. The reason that the aneurysm is important is if it ruptures, it can cause you to have a hemorrhagic stroke. Now, as it pertains to what we call a transient ischemic attack, or quote unquote a mini stroke, the difference between a stroke and a mini stroke is you have this onset of neurologic deficits that happen, but then it gets better and you return back to your baseline without being treated. And usually that happens within or less than 24 hours. So you may have some weakening of your face. You may have facial drooping. You may have some numbness or tingling in your hands or changes in your vision that happen. They may last 5 minutes, they may last 5 hours, but then they improve on their own. The reason that that's important is just because you get better does not necessarily mean, number one, that event can't happen again. And number two, if it happens again, it may lead to a full stroke in which now you are left with a permanent deficit. So the reason that I tell people TIAs are important to keep in mind is, even though you go back to feeling normal, it is a harbinger or an indicator that you have an underlying vessel disease that may cause you to have a full-blown stroke in the future. So you need to be seen immediately and you need to be treated, and you should treat that as if it were a stroke. Up to 9 to 10% of patients who present with a TIA at 90 days end up having a full-blown stroke. And so, that's what I would say would be the difference between the TIA and the stroke. It gets better within 24 hours, but it still is an indicator that there's something going on in the brain that needs to be treated.
Next up, we welcome back Michelle Blaylock from Kroger, who's become a regular in our Aging in Atlanta series. Hi, Michelle.
Hi there.
So here's a question I think that really is on a lot of people's minds. How can I tell if I'm current with my vaccinations, and where can I get them?
Perfect. I think that is a great question. Immunizations are important as they ever are right now to protect ourselves and our loved ones from diseases. So a good place to start is your primary care doctor. Every visit I would go, I would ask them to check on your immunization status. And a lot of times they can provide routine daily vaccines in the office with the visit. Another source is your public health department. They also serve as a great vaccination resource. My personal favorite is going to be to visit your pharmacy. So we are happy to help you with your immunizations. We actually have a state registry where we can look up and see any of your vaccines that were given in Georgia. Any of your healthcare providers can have access to this registry. So when we give you a vaccine, your doctor gives you a vaccine, we're able to see this so we can address your best care. If you come to the pharmacy, we're able to tell you which vaccines that you are in need of. We can administer those to you, bill your insurance, and we also give you a yellow immunization pocket size card. So you are able to keep that with you at all times to make sure that you are up to date on all your vaccines.
So following up on vaccines, this is another question directly from one of our readers. What are the priority vaccines for seniors right now, besides obviously the COVID-19 vaccine?
Yes, there are also other vaccines that are very important for seniors to obtain. Two of the primary ones that I think are very important are going to be your shingles vaccination and your pneumonia vaccination. So your shingles vaccination, what currently is on the market right now and recommended by the CDC, is a Shingrix. It is a 2-shot series. So you would receive a first dose and then a second follow-up dose within 2 to 6 month time period. So those are available at your doctor's offices or the pharmacies. Anyone over the age of 50 is recommended to receive a shingles vaccination. The other important vaccination is a pneumonia vaccination. So anyone over the age of 65 is indicated for at least one pneumonia vaccination. You might even require one before the age of 65 for certain health conditions. And those include common health conditions such as asthma, diabetes, chronic heart conditions would require one pneumonia vaccination before the age of 65. Other vaccinations that you should also make sure that you're up to date on is your Tdap. So what is required from the CDC is a Tdap booster every 10 years. So it is important to try to check with your doctor or maybe where you might have received that last vaccination to see if that is current. The other vaccination that you should also make sure you have is your yearly flu shot. So you're able to get that every fall season, and you should be able to look out for those in your pharmacies and doctor's offices as soon as they're available.
Thanks for that, Michelle. Now, obviously, it's important to have this relationship with a pharmacist, and I'm sure that that's a big part of what you do. But what's the most important information that you should provide a pharmacist to make sure that you get the best possible care and results and I guess medication when you need it?
Absolutely. So I hope that everyone does have a good personal relationship with your pharmacist. We consider ourselves to be a cornerstone of your healthcare. So we interact a lot with your different physicians and are able to keep you as healthy as possible. Some things that we would need to have updated, make sure, first of all, we have your good contact information. So make sure we have your updated address, email, and phone number so that we can contact you if a situation arises. The other thing that would be important is your allergies, any current health conditions or any past drug interactions that you may have encountered throughout your history. Our system, as we receive medications from various doctors, we are able to detect if there's any allergy drug interactions and be able to talk to you about those and talk to your physicians about a better possible alternative if we see an issue. I also suggest let us know any preferences for your health care. So a lot of times if you have arthritis, we can put easy caps so it's not hard for you to take off your medication caps from your prescriptions. If you have a son or daughter that can also speak about your health care, call and let us know and give us their phone number so we have another point of contact to contact you if in case anything arises.
So a lot of us are setting up online accounts at our pharmacies. And tell me, I mean, from a pharmacist's perspective, why is can that be a good thing to do, and how does that help?
I highly encourage anyone to have an online account for their pharmacy. So a lot of the information that we just discussed that's important for us to be updated can actually be updated through an online account. So insurance information, changes in your contact information, changes in your healthcare can also be accessed through your online portal. Another benefit of having an online managed account is that you can able to manage your own prescriptions. You can see all your prescriptions in process, and you can also see their cost and process time. So instead of knowing that your doctor is going to call something in, but don't know if it's ready or not, if you can go onto your portal, you're able to see if we've received the prescription, what time it will be ready, and the estimated cost, or if there's any problems with your prescriptions. We also have wonderful programs online that can help educate you about your medications. We have auto refill programs so that way your medications, you can choose which maintenance medications you would like to have automatically filled when they are out. We also have adherence programs, so things that will help you, reminders that will help you take your medication, and important drug information about the prescriptions that you are taking. I also believe another great benefit of having an online account, and hopefully this serves as a great benefit, is when it comes tax time, we get a lot of requests for annual medical expense statements. If you have an online account, you're able to print that from the comfort of your own home and not save you a trip from the pharmacy.
Michelle, so we're going to talk a lot about travel here a little bit later in this program, but obviously a lot of people are planning to travel now that it's available again. So what kind of tips do you have to make sure people don't run out or run short of medications when they travel?
Yes. So my recommendation, if you're going to be traveling, is I'd say about 7 to 10 days prior to your departure, go ahead and check stock of your medications and count out what you think that you will be out of or what you will need before you decide to go. Once you've kind of determined what your need is, give the pharmacy a call. Some medications can be filled early without any type of prior approval, so those won't cause an issue. There might be some medications that the insurance will not pay for just yet. In that case, what you might need is a prior authorization or an override from the insurance company. So you can call your insurance company and let them know the dates that you'll be out, and they can also provide an override for the pharmacy so that you can get those medications a little bit earlier before you leave. If you happen to be out of town and you've already left your medication, you do still have options to be able to help you with that. My option would be to try to find the chain that you do have your prescriptions at. That would probably be an easier way, and they can assist you with getting those refills. However, if you're in a place where you maybe don't have your regular pharmacy chain there, any pharmacy can help you transfer any prescriptions that you would need as you are traveling. One other tip I would say is when you're traveling, also make sure to check your over-the-counter medications you bring. So you might want to bring some extra Tylenol, Motrin, hydrocortisone cream, maybe some Benadryl. So those are important things to probably just have in your little mini first aid kit as you travel. If you have those things at home, make sure do check the expiration date if they've been sitting there for a little while. So you want to double check that.
Thank you, Michelle. That's great information. Now we're going to come to Dr. Justin Hart, and we're going to talk about, I think, some men's health issues. So, Dr. Hart, it's good to have you. We'll start right with a core sort of question on men's health. How are patients screened for prostate cancer?
It's a great question. Again, thanks for the invitation. I'm looking forward to hopefully clarify a little bit of this, and sort of to dive in. It's really been an area of controversy. So I'm hoping today we can talk about how and why. But screening for prostate cancer has been around for a long time. And for many years, it's consisted of screening with blood tests for a PSA, prostate specific antigen, sometimes also an unpleasant physical exam.
So who's most likely to be diagnosed with prostate cancer now?
We now kind of better understand that prostate cancer is a process that as men age, there's an increased risk of developing prostate cancer. Some studies suggest that up to 80% of men who die of other causes at the age of 80 can have findings of prostate cancer, unrelated to their cause of death. So we know that it is a risk for men, and it's a risk that increases with age. But much of what we now understand is that not every prostate cancer carries the same threat or risk of harm to the patient. And that's really been a very big development in the last 10 years in our clinical management.
How worried should a person be about prostate cancer affecting them or a loved one?
So it's a really good question. So I think, what's happened now in the field of prostate cancer is the updated guidelines really recommend that men from 55 to 69 talk about screening or considering screening for prostate cancer with their clinician. So it is an individual decision now based on all of the recommendations. And basically that means that you need to talk to your doctor, primary care, urologist, about whether or not you want to screen for prostate cancer. And that means you have to understand that screening can have some side effects. But what we're trying to do is identify patients that have prostate cancer and have prostate cancer that may pose a threat or harm to them. And that's really where the field has changed in the last 10 years. So, to speak from personal experience, I'm a doctor. I'm also a son. And, I spoke to my father about this. He's up in his young 70s. And after some time, I brought him down to the WellStar system. He lives out of state. So that he could sort of go through this process with some urging on my behalf to sort of begin the process and try to understand whether or not he wanted to screen, and then sort of how to go from there within our system.
So what is the best treatment for prostate cancer?
Yeah, so there's a numerous options for patients. Really, I like to tell patients when we meet with them within the WellStar system, I work with a great team of urologists, so I offer radiation therapy. Really, we try to help them understand before we get to what's the best treatment. There's really two broad categories of prostate cancer now. We understand many patients are going to be diagnosed with low-risk prostate cancer or favorable prostate cancer, and those patients have the option to not treat their cancer and do something that we call active surveillance, which means with medical guidance to monitor the status of their cancer and determine if and when they want to treat it due to the fact that we may or may not, have a risk to the patient. So really, some patients have the option to do this active surveillance. I'm happy to tell you at WellStar in 2019, 72% of the patients diagnosed with early prostate cancer, favorable, low risk, chose an active surveillance. That means nearly 3/4 of our patients are opting to not treat their prostate cancer, which is perfectly recommended and an approved management. Now, treatment, if patients decide, can be either with surgery, typically removal of the prostate plus or minus some lymph nodes in the area, again, performed by my urology colleagues, or radiation. When patients make the decision to treat prostate cancer, we talk to them about the various pluses and minuses of both, and then sort of help them make an individual decision based on sort of their preferences and how they want to approach things if treatment's needed.
Dr. Hart, a couple more questions that are directly from our readers, and here's the first. Are there any changes to diet or lifestyle that can help prevent prostate cancer?
Yeah, so we have a nutritionist. We often send patients to see them, when they have questions of that nature. I think the closest we come to that is that some treatments can cause different side effects, weight gain for treatment. But I'm not aware of any dietary, changes that can reduce the risk or alter the incidence of prostate cancer.
I think this is a great question. My father and brother had prostate cancer. As a woman, does that put me at higher risk for other types of cancer?
So we are learning, and I think that in many ways, prostate cancer is just starting to catch up to our understanding of the role of genetics that we've long understood for breast cancer. What's interesting is that some of the genes that we now understand may increase a man's risk for having prostate cancer are similar genes that we understood, more than a decade ago, increase a woman's risk of having breast cancer. So that's a great question. And I think in years ahead, we're going to understand more how those risks overlap for both men and women. We're proud to have a wonderful genetics program. And so now there's more and more role for patients diagnosed with prostate cancer to consider seeing a genetic counselor and having that discussion and kind of looking at those genes. They have implications for the patient. They may also have implications for the patient's children, family members, and as the questioner asked, also potentially for female members of the family.
Dr. Hart, in the past, I've had friends who've discovered that they've had prostate cancer, and then they had to have what was apparently very difficult and traumatic surgery for them. Has that changed?
Many of my patients come in after this diagnosis, and that's one of their first questions. So the truth is much has changed. And this is a field of cancer management in the aging process that has changed dramatically. So we tell patients that, 10, 15 years ago, it was very common that once a prostate cancer was diagnosed, there was essentially an option to treat with surgery, which is a radical prostatectomy, in some cases to treat with radiation, which I remind patients is also, an aggressive therapy to cure cancer, which comes with side effects. Really now in the last 8 to 10 years, we have become very strong proponents for the appropriate patient, and in a subset of patients, in our case, more than half of patients can safely opt with physician and support to not treat their prostate cancer. So this is really a game changer. If the criticism is that we were providing, surgery or radiation for every prostate cancer, that comes with side effects and toxicities. We are now able to counsel patients and appropriately, allow patients to avoid these treatments when it is deemed safe, and we can manage their cancer with observation or active surveillance. Many patients are thrilled to hear this. It's a dramatic change. It wasn't on the table 10, 15 years ago, maybe even in some places 5 years ago. But we have literally had patients, sort of grin, take that information to heart, and come back and tell us that's exactly what they want to do. And it's a problem that you monitor, but you can avoid all of the side effects and toxicities that come with these therapies if you're an appropriate patient for that management.
Thank you so much, Dr. Hart, for that information. So now we're going to take a quick break before we get to our next panelist for a message from St. George Village. Welcome back, and let's continue with some questions for Brendan from Georgia Relay. So Brendan, just not everyone knows about Georgia Relay. Just tell us what it is and what it's about.
Yeah, sure. So Georgia Relay is a free public service. It's provided by the state of Georgia that makes it possible for anyone to make and receive telephone calls. The service is designed for people who are deaf, hard of hearing, deaf-blind, or have difficulty speaking and are unable to make a traditional phone call. There are several types of service of relay ranging from TTY to speech to caption telephone.
So explain that caption telephone. What does that mean?
Yeah, so caption telephone, or as we say for short, CapTel, is available for individuals who are hard of hearing and who have difficulty hearing what's said over the phone. As the name implies, caption telephone is a service that provides captions of what another person is saying on the telephone. So when they use the CapTel phone, you speak directly to the other person, and when the other person responds, captions appear on the display screen of the phone. The CapTel phone is also an amplified phone, so you're able to listen to it at a preferred volume while also reading the captions. And then in addition to that, captions are available through the use of a computer and a tablet as well. So it's not just specific to this specific CapTel phone.
So what's that like for someone who's using it? I mean, what is it in their daily lives and putting it in place, that sort of thing?
Sure. For someone who's using the CapTel phone, it's very easy to use. First of all, it's just like a regular phone, except the user gets a full, clear understanding of what is being said with the addition of those captions. And related to the caller on the other end, for them, really, it's no different than making a regular phone call.
So how much does it cost and how do I get it and how complicated is it to put in place?
Well, the phone, the CapTel model phones are available at no cost to qualifying individuals. That's through our state equipment distribution program, the Georgia Center of the Deaf and Hard of Hearing. What I would recommend for you all is, if you want more information, if you visit our website, georgiarelay.org, there's more information there on CapTel services in addition to some of our other services as well.
Now, do I have to go through my doctor to qualify?
So there's a few different ways to go about getting the CapTel phone. One of those routes includes having a doctor certify that you have the hearing loss. And when you go that route, it qualifies you for one of our free CapTel phones. In addition to that, as I said, you can go through the state program, the Georgia Center for Deaf and Hard of Hearing. That involves a qualifying process based on income level. And then there is a third option as well, where you can buy the mechanism outright. So one-time fee, it's $75. And I always kind of tell this story for those of you who have seen me in person over the years at the Aging in Atlanta events. I usually bring up my grandmother. So I would say for about 10 years or so, she's really needed to address her hearing loss. And she's from London, and so I usually pull out the British accent here. Oh, darling, I don't need that. But what we did is we went ahead. She didn't want to do the paperwork route or anything, so we bought it for her outright, and it's been a game changer for us as a family. You know, before, one of the biggest things that was an issue for her was if you called and left a message on her answering machine, she couldn't hear it. So she would wait for someone in the family or a neighbor to come over to listen to it, to tell her what she was missing. One of the features of the CapTel phone includes captioning for your messages. And so for her, that's really just made a world of difference for her.
One final thing here, Brennan, does this only work with phones at home, or does it work with mobile phones?
So right now we have options that are available with your computer or tablet. We are also in the process of working on an app as well. And there is more information on our georgiarelay.org website related to all of those services.
Okay, thank you. Finally, we're going to get to Robin, and we'll talk about, a topic that's obviously been in the news: travel, going on cruises. So welcome, Robin. And I guess, the first question, you had to expect this one when, from a reader. I am sure safety precautions are top of mind for planning a vacation. Talk about those and how people can make sure what their travel plans include will keep them healthy while they enjoy themselves.
Yeah, absolutely. And trust me when I say that that's also top of mind for us. It always has been, but now it's even more important. And even with the start of the pandemic, which caused, of course, a global suspension of cruising, at that moment, we started already, planning for a really healthy return to service. And so we've been working on that for now over a year. One of the big initiatives that I hope makes everyone feel really comfortable is that we set out with another cruise line partner to develop a healthy sail panel, which was a group of experts, independent of us, from experts in virology and epidemiology and public health and maritime operations, as well as hospitality. We have people that have been in former government roles, also working with the CDC, to formulate a plan going through every inch and every interaction that would occur on a cruise ship, to formulate plans of what we need to do. Fortunately, we've been able to try out a lot of those protocols because we've actually been sailing in Singapore for several months and have carried over 100,000 passengers very successfully.
So, so many people enjoy cruises or have been on them before, for sure.
Yes.
Should they prepare differently now than they have prepared in the past?
Good question. So I think it's really important to be thinking about how do you actually do the planning. So my advice is definitely work with a travel partner, a professional agent, because they're very much in touch with us. I would also have everyone be thinking about mentally be flexible. Unlike if you were going to an individual resort, you're dealing with one government, one location, and not having those changes that could potentially come up. So we have an amazing team of experts that work with all of the governments. And again, because safety, along with having a wonderful adventure, is top of mind for us, just also, again, just being very mindful and staying in touch with either a travel professional or with us directly on what those changes could be going on.
And so here's one directly from a reader. What are the hot destinations and ships for 2021 and beyond?
Oh my goodness, I could talk an hour for that, but I'll just highlight a couple. So actually really excited. One of the hottest ships just came out, and she will be heading to the Mediterranean for us, but Odyssey of the Seas, and she is part of our ultra quantum class. Very high tech, a lot of fun things to do, including things like we have a partnership with iFly, so we have what's called Ripcord on board, where you can, get up there and practice skydiving, and it's included in the fare. But she'll actually make a debut in Fort Lauderdale in November, which will be nice because this will be the first time we've had that class of ship available in the U.S. And I would say destination-wise, it depends on what you're looking for. Right now, of course, the Caribbean is always huge for us. We've launched some new sailings that will actually depart out of Barbados so that you're further south in the Caribbean and can actually island hop every single day that you wake up. You're going to be on a different island, which is kind of a nice way without having to have that extra time to sail there if you're leaving from Florida. Alaska is always big. It's got a season that is just over our summer, and it's one of those places where if you've never been to Alaska, it is both culturally amazing. The natural scenery is unbelievable. I mean, just imagine like the Hubbard Glacier is 40 stories high, and you're right up against that, and it's 6 miles long. So when you all see pictures of glaciers, probably don't picture that they're that large, but it's just amazing. I would say for Europe and the Mediterranean, if you can get out to the Greek Isles and have a sailing that's going to both go to Mykonos and Santorini, and just seeing that unbelievable palette of colors and that beautiful water, that's really big. But for those super adventurers, most people don't even know this. We have sailings that are repositioning our ships that you can actually be on. There are some that do Trans-Pacific, so you could be enjoying Bora Bora along that sailing that might be going from Tampa to Barcelona. We also do one that takes you into a deep immersion into the Canary Islands. So there's a lot of really great opportunities depending on what your personality is and what you want to explore.
How about your advice for those who've not been on a cruise and are thinking about going for the first time?
Yeah, I would. My advice would definitely be consider it more of taking advantage of the journey, because just being on the ship is a huge part of that vacation, as well as the destination of where you're going. A lot of people are used to focusing very much on travel as where am I going to go, not realizing that if you've never been on a cruise ship before, the level of innovation, the high class dining, the entertainment is unbelievable. We actually even have true Broadway shows on board several of our ships. Just having a lot of opportunities to explore, and don't ever think that you're going to spend time in your stateroom the entire time frame. But again, for that first time sailor, definitely use a travel professional, a local one, because they can get you on the right ship at the right time, doing the itinerary that's going to fit best for you.
And how about the idea of, a family, like a multi-generational group where you've got, different interests, different capabilities, and what's your advice there?
So even from a personal basis, I've got boys that are now 20-somethings, but it was always, if we were choosing a vacation, you got to make this one happy. That one doesn't like to do this. Is this one going to be upset because we're all going to, decide that we're going to go on this tour, and that's totally not their alley. But instead, I think what sailing provides is you're in a safe environment that teens can go and do things, and we have amazing programs for them to be able to get to connect with other teens and not be stuck under their parents' wings the entire time. We also have an amazing children's program, very award-winning, called Adventure Ocean, that lets those kids also have time without the parents, and likewise the parents without the kids, and everyone can come back together for meals. If you're traveling with older guests, also, we have a lot of support for accessibility, as well as activities that may be more their speed, as well as those that want to have a heavy nightlife. Bar hop on board, that opportunity is available too. It's wonderful for multi-generational.
Thank you, Robin. Okay, I can't thank our panel enough, and here's what we're going to do as we approach the end of our program. I'm going to come back to each of the panelists and ask them for their just a final thought, something they'd like to leave our audience with. And I'm just going to do it in the same order that we went. So we'll start with you, Shannon, and Dr. Humphreys will be coming to you next. So Shannon, unmute yourself and give us a final thought.
My final thought would be that life is a journey, and on a journey, we have different destinations, and we have different sites, and we have different experiences, whether those be different experiences on a vacation, such as Robin was talking about, or different health situations, such as spoken by Dr. Humphreys. As life is that journey, we need to make sure that not only are we taking care of ourselves, our psyche, our person, we got to make sure that we're taking care of our lineage and our estate and our focuses for our legacy.
Thank you, Shannon. Dr. Humphreys, and then we'll be coming to you, Michelle.
I think my final thought would be just to remember that the way that we provide neurovascular care and the way that we take care of the central nervous system has evolved drastically. And so the types of things that we have access to in terms of providing comprehensive care, we have here at the WellStar system, and we are very much looking to be one of the leaders in providing that neurovascular care, not only for the city, for the state, but for the country as well. I think it's important, though, to also understand that no one physician or no one medication can provide this type of care. It's important for the healthcare system to have a working relationship with the community such that it's able to provide that care in what we call a way that's patient-centered, evidence-based, and compassionate. And so that's why I'm excited to be here. And that's why I hope you guys will continue to work with us to advance the field of vascular neurosurgery and neurovascular care.
Thank you, Dr. Humphreys. Michelle, we're going to come to you. And after Michelle, it'll be you, Dr. Hart.
Yes, I think my final reminder is just that your pharmacy is really the cornerstone of connecting your healthcare with all of your physicians and all of your medications. I think there's a lot of value in your pharmacy. We're the most accessible healthcare professional that you can think of us for immunizations, OTC recommendations, and just overall disease state management. So please just don't stop by and say hello to your friendly pharmacist.
Thank you, Michelle. Dr. Hart, and then we'll be coming to you, Brendan.
So I think to wrap, we just want to encourage patients, men and their loved ones, to consider, reaching out to your providers, certainly your WellStar providers, to talk about PSA screening, talk about prostate cancer. We want to assure you that we'll take your individual preferences to heart. And if indeed there's a prostate cancer diagnosis, we'll work with you to find out the best management, which in many cases may be something called active surveillance.
Thank you, Dr. Hart and Brendan. And then finally, Robin, after Brendan, we'll come to you.
Well, yet again, Kevin, thank you for having me today. I hope that what you all have learned today can change your life the same way it's affected my family. And related to needing assistance or getting a CapTel phone for you or your loved ones, recommend that you visit our website, georgiarelay.org.
Thank you, Brendan and Robin.
I would just say, I hope everyone, especially with the sort of year that we've all endured, give yourself the gift of being able to dream. What is it that you want to go ahead and have planned? What do you want to have your family be able to look forward to, especially the amount of separation we've had from our families and friends and loved ones? Get something booked so that you can, have that opportunity to get back together and explore.
Thank you, Robin. In closing, we'd like to thank our presenting sponsor, Kroger, and our gold sponsor, WellStar Health System, for making this program possible. We'd also like to recognize these supporters of the Aging in Atlanta program. Be sure to visit ajc.com/aging for updates on senior living topics and a recorded broadcast of this event. You can sign up for our new Aging in Atlanta newsletter there too. Thanks for joining us today. We believe these events are part of our mission to keep the community informed and a way for us to give back to you, our valued newspaper subscribers who help fund our local journalism and our journalists. We look forward to seeing you again in the fall.